How is everyone doing? Hope you're all doing great. Nice to have you here again. For those who don't know me, I'm Dr. Max. I am a medical doctor, of course, and this is Dr. Max Health Support Community where we help, I give medical information to help you make better health decisions. I answer questions that you would have regarding your health that you probably forgot to ask the doctor, or the doctor did not have enough time to answer. You can bring those questions here and I would answer. I'll touch on topics that relate to general health, weight loss, blood pressure control, blood sugar control, and from time to time we touch on some other topics that are, generally um, well known to have a lot of questions. Um, as well as things that affect almost everyone. Like today, when we're talking about headaches. So, aside the main topic that we will be discussing, please feel free to ask any other health question related to your health or any other medical question that you want to ask. It does not have to be related to the topic we're discussing. Now, you can drop your question in the comment section or you can click the link in the description to join the WhatsApp group because it's a WhatsApp community where you can ask your question any day, anytime, and you will get an answer. I think that was a very good introduction. Huh, I tried. Okay, so today we're going to be talking about um, weight loss. Sorry, I said weight loss. Sorry, we're going to be talking about headaches. Now, just a second, I'm going to be joining our WhatsApp community so that those online on WhatsApp can also listen in the conversation. So we usually have two live conversations ongoing here on YouTube and also on WhatsApp. Just in case there's a network issue, you can just switch to another. So that's something that was very important for me to say. Now, before I get into the proper topic of today, which is headaches, I need to get the community here to join. So let's just do that. Okay, so I have dropped the wave on the group. I have dropped the message on the group so that people on the group will know that the show has started and they can join in. Okay, now of course the topic for today is headaches, and I really want and if you haven't shared the link is currently in the in the on the WhatsApp group. You can share it on your status. If you haven't, if you're on YouTube, you can forward the link to your WhatsApp status because headaches really a particular headaches in general, right? They apply to almost everybody. Everyone has headaches, and usually there are questions. Oh, I don't want to get used to taking drugs. I don't want to start relying on drugs. Or this drug can cause this issue. Why am I always having these headaches? And people have, so many questions unanswered. So please, if you haven't shared this live stream anyway, please feel free to do so. I encourage you to do so. Let's get as many people as possible into the conversation. Someone else might ask a question that you did not think to ask, and it would actually be of help to you. So that's something very important to put out there. And I think now we can start because it's 4 p.m. on the dot. So let's go. Headaches. Headaches. There are different kinds of headaches. In fact, there are over 150 different types of headaches. Yes, over 150 different types of headaches. So we are not going to go into detail on what kind of headache it is and all that, no, because we will sleep here. And I really want to keep this conversation as short as possible, considering that headache is a major topic. Just so you know, for those of you who don't know, there is a specialty. In fact, there are specialists, there are people who specialize in headaches. For you to know how broad the conversation is. It's a big conversation. So we're not going to try and get too deep into the details. I'm saying this up front so that you know that whatever information I'm giving you is not necessarily exhaustive. It's not like, oh, when you now go outside and you hear something else that I did not say, you say, ah, but that doctor did not mention this. No, 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 it's not like that. Headaches can be a very broad topic. Okay, headaches are a very broad topic. So I'm going to give you as much information as I can give you in a very short time. But please keep an open mind if you see another doctor or there's something else, and feel free to ask questions. So I am intentionally going to focus on the most critical things that I think you need to know. Okay, that will be my focus. Now let's start. Two types of headaches. So there are different categorizations of headaches, right? I'm going to show you the different categorizations and just pick on the most important things that you need to know. One categorization is based on the duration of the headache. How long have you had the headache? You know, so when you speak to a doctor, you say, I have a headache, they always ask you for how long, right? They should ask. Because there are two types. There are acute headaches and chronic headaches. Acute means short duration. In other words, you probably had the headache for a short period of time, maybe it started yesterday or it started this morning, but it's really bad, it's really severe, right? Acute headaches. On the other hand, you have chronic headaches, headaches that last months, okay? Very long duration, it's either persistent or just recurrent, give you a short break and then it comes back again. Chronic headaches. These are two different classes that will be addressed differently. Now, what is important to you here is for the acute headaches, what are the causes? Usually, it's the typical things that anybody around you can tell you. Hunger, have you eaten? Stress, your workload is much. Malaria, you're not feeling so well. Uh, sorry, I want to make sure I don't miss anything. Poor sleep, you did not sleep well overnight. Very, very important. Okay, poor sleep, you did not sleep well overnight. That could be the reason. All these, and then maybe you are dehydrated. Like I said, you've not eaten at all. Stress and all that. All these could be the reason why you are having an acute headache. It's usually not much of a big deal, to be honest. Acute headaches are, we're not going to spend much time on that because they might be very severe, but usually, it's something that most times you know why you're having the headache. In conversation with someone who is not even a doctor, oh, did you sleep well? Or is it that you've not eaten and all that? So usually those are acute. Now, where the focus will be now is the chronic headaches. Those headaches that last for months. Those headaches that will come and maybe you rest a bit before you know it, the headache has come back. Okay, chronic headaches. What are the causes? Now, one thing that's important to note for us to call a headache chronic is that number one, it feels the same. Here's something that's important to note. You need to know how to characterize your headaches because you can have two different types of headaches going on in different intervals. So let's say someone is having, chronic headaches that have been lasting for months. Inside that same scenario, that person might have a day when they did not eat and that's why they're having a headache. It's different. However, how you will know is that the character changes. So the headaches you are familiar with, they're usually on the right side. But one day, you're just having this kind of high pressure headaches like all over your head. That's different. So knowing the character of the headache will help you know whether it's actually chronic or not. So if it's a situation where you can categorically say that I usually have this headache on this side of my head and it's always there, I rest a bit to go, or maybe I take a drug, it will go and then come back and it's the same type of headache. Now you are sure of the headache you are talking about and you know that this is chronic. Okay, again, for some people who have a bad lifestyle, right? You're not sleeping well and all that, you just be having a mix of different kinds of headaches. You know that it's your lifestyle. Okay, it might not necessarily be the chronic one that we're talking about. So it's important to be able to characterize the kind of headache, characterize that headache. It's important, okay, especially when defining it as acute or chronic. So chronic, like I said, more than a month. Typically, you can have up to 15 episodes or more in just 1 month. So you realize this person is always taking paracetamol, always taking Panadol, always taking, pain relief medication up to 15 times in a month for 3 months or more. Okay, that's when we call it chronic headache. And remember, it's the same type of headache. Okay, so that's something that's important to note. That's on one. Now you keep that, just put that in a cooler. We're coming back there. Put that in a cooler. I'm trying to make sure I give you information that is useful for you. We're not going to useful for you. Just pick out what is useful for you. Now we're also going to talk about another type of headaches we call primary and secondary. Primary means that it is, in fact, before I talk about primary, let me just talk about secondary. Secondary means that it is secondary to something. In medicine, that's how we say it. You have a condition that is secondary to another condition. In other words, there is an underlying medical issue that is causing that headache. It's not ordinary, it's not just headache on its own. That's what we call a secondary headache. The headache is happening secondary to another medical issue. Now, of course, when we talk about secondary headaches, to be honest, there is almost no medical condition that cannot present with headache. So it's a wide array. So we're not going to waste too much time on secondary headache because, to be honest, when we start thinking of all the different medical conditions that could be causing the headache, we'll sleep here. However, a few ones that you should note. Number one, please pay attention for secondary. Please pay attention. For women in particular, anemia, low PCV, when the blood level is low, anemia. Why? Because women often monthly they have their menstrual flow, right? And one of the signs that your blood level is low, even if it's just borderline, all right, but it's still relatively low. One of those signs is recurring headaches. So the PCV is low, the person has anemia, the person can have recurrent headaches. Now, in men, it can also happen too. However, for men, it might be due to tapeworm infection or worm infestation. Hookworm, tapeworm, those worms that will enter your intestine and be sucking your blood. You'll be drinking the blood, your blood level will be going down, and that person will start having headaches. So it is important to note, if you have not dewormed in the last 6 months, I hope someone is listening to me. If you have not dewormed in the last 6 months and you keep having headaches, please go and deworm. Let's just start there. Not necessarily because we are 100% sure that's the cause, but let's just know that we've addressed that. Deworming is, I'm not going to prescribe. I'm tempted to prescribe, but let me not prescribe. Right? So if you have not dewormed in the last 6 months, go and deworm. Let's make the conversation easy. All right? So, anything that causes you to lose blood, whether through tapeworm infestation, menstrual flow, or injury, severe injury, or any other condition, some people, stool and they pass out bloody stool and all that, can cause headaches. Low PCV. Important to note that. Another one that can is heart disease. Any issues that affect your heart. So if you notice your chest is always pounding, boom, 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 boom. Your chest now, not your head. We're coming to the one of your head, but your chest always pounding, right? You feel breathless, you get tired easily, and you have headaches, probably with some dizziness or something else. It could be a sign of a heart issue. Remember, we are not saying everybody who has headaches would be in this category, but we're saying that when these symptoms come together plus the headache, it could be a sign that there is an underlying issue that is causing that headache. I just spoke about anemia, and one of the other symptoms of anemia that your PCV is low is a general weakness, breathlessness. All right, you are always tired, always weak. Okay, sometimes dizziness, sometimes you hear a ringing sensation in your ear. So when you have that plus headache, then it could be that your blood level is low. All right, I did not send you to just go and start drinking blood supplements. So know what I'm saying very well. Okay, and then we also said if you're having symptoms around your heart, you feel breathless, you feel your chest pounding for no reason, and then you're having headaches, it could be that there's a heart issue related. Other general ones, when blood pressure is high too. Okay, not all the time, not all the time, not all the time. Okay, sometimes when the blood pressure is high, it can present with headache. However, I must stress that high blood pressure doesn't particularly have any symptom. So it is only those who are lucky who actually have headaches. When they have the headache, they now check and see the blood pressure is high. They say, oh, it's because of the blood pressure. They are lucky. A lot of people have very high blood pressure and they don't even have headache. I must stress that. But yes, it can be a risk. And then we have cerebrovascular accident. That's things like stroke, bleeding in the brain, brain tumor, and all that. All these are, and like I said, many more. Electrolyte issues, kidney issues, and we can go on and on. But these are just some of the common ones that I wanted to point out, right? It's not exhaustive. Secondary. And now let's get to the crux of where I want us to enter. Yes, I'm going at the right speed. Yes, I wanted to be sure I'm going at the right speed. Primary headaches. We just talked about secondary to something, right? Primary, in other words, there is not, it's just headache for the sake of headache. You might even want to call it spiritual. Because to be honest, there is nothing causing the headache. Absolutely nothing. No medical issue. And some people have even said that for some types of primary headache, it could be genetic, and we'll get to that. Okay? Now, what this happens when there's just a dysfunction, or a dysfunction that is affecting the sensitivity of organs, or should I say organs, or pain sensation. Let's just say a dysfunction of pain sensation around the head. That's just it, right? Like I said, look at my word, dysfunction of pain sensation. That was, for some reason, your pain sensation is just misbehaving, and that's why you are feeling headache. It's not that there's anything causing it. Okay, that's primary. Just primary headache nikoni. That's all. There's nothing else involved. And this one is very, very dicey, because you see, for the secondary headaches, we know that if we treat the issue, if it's PCV that is low, if it's heart issue, if it's that you've not eaten, if it's malaria, we know that if we treat it, you will feel better. The headache will stop, right? But for primary, you now have to just focus on the headache itself. There's nothing else, right? And that can be a bit dicey, and that's where we now have the different types of headaches I'm now going to talk about. A lot of people, everybody just says, "Oh, I have migraine. I have migraine." It's not everybody that has migraine. Migraine is a type of headache, and we're coming there. Okay. Now, for these primary headaches, I'm going to now divide them into two categories. There's the one that is based on your lifestyle. In other words, your pain sensation is misbehaving because of things that you are doing. You are the culprit. Okay, come there. Then there's another one that it's not really because of anything you are doing, but just because of just because of the way your body is, if I may just say so, right? Just the way just your biology, if I can put it that way. And for this, there are three major types. Remember, I had said that there are over 150 types of headaches, so we're not going too deep. But majorly, there are about three types. Number one is what we call the tension type headache. Okay, the tension type headache is a type of primary headache, and it is the most common type of headache. That's why when I said a lot of people just claim to have migraine, I I usually doubt it. The most common type is tension type headache. And how does this headache feel? It feels like there is a band around your head, like there's pressure on your head. Okay? Like there's pressure on your head. We call it tension type, like there's tension and pressure around the head. That's what we call a tension type headache. Okay? And oftentimes it's caused by just the muscles and the tendons and all that, the organs around your head. It's like they're just tightly knitted together. It's like they're, how, what word can I use to describe it now? It's like they're just, knotted together. Oftentimes, it can be due to emotional stress. And people would not think about this, right? Yeah, due to emotional stress. It can be due to the way you use your phone. Okay, it can be due to the fact that you are bending down to look at your phone. All right, you are straining the muscles of your neck. Okay, it can be due to that. It can be due to the fact that you are straining the muscles of your eyes. you've been on your system all day, you've been doing whatever it is, you are straining, or maybe you can't see clearly and you are straining to see. Okay, that's why one of the questions I always ask people when they say they have a headache is, do you strain to see? Every doctor would ask you that, because if you keep doing that, you're going to develop tension headaches. It feels like there's a pressure around the head. Also can be caused by anxiety and depression. Yes, emotional issues, anxiety, depression. Okay, these are mental health issues that can be the reason for the headache, and you don't know. You are worried that somebody is cheating on you. You are thinking about house rent. You are thinking about bills. You are thinking about how to plan for that event, right? All these mental health issues could be the reason why you are having tension type headache. Okay. Um, and something that's characteristic about tension type headaches is that they are not necessarily, they don't change based on whether or not you are active. So whether you stand up, sit down, walk around, rest, blah blah blah, it doesn't get worse. It doesn't necessarily get better. Okay. One thing that might change it is if you identify the cause of the tension type headache, the thing that you are doing. And this would easily fall into the category of lifestyle. And yes, it actually is, but I'll explain why I put lifestyle issues aside. So from time to time, I might touch on some lifestyle things while talking about these types of headaches. All right, just permit me. It's because they are intertwined, right? They are intertwined. So tension type headaches, once you can identify the thing causing it, and you stop that, you should start to get some relief. But whether you decide to, it doesn't get worse because you are working or you are not working or anything like that, unless you identify exactly what is causing it. All right. There are other types of headaches that get worse by certain triggers. Tension type headaches usually are not like that. Something has triggered it, and until you identify what that particular thing is, any other thing that you are doing won't make it worse, won't make it better. All right. So if this applies to you, you can take note of it. It's a tension type headache. All right. Nothing just seems to change it being better or being worse. Important to note that. Another type of headache is our commonly abused one, migraine. Okay, migraine. Characteristics about migraine. Oftentimes they are one-sided. Remember we said tension type feels like there's pressure around the whole head, like they tie the band around the head. Right? That's tension. Now migraine usually one-sided. One-sided. Now don't get this wrong. In some cases you can feel the headache on both sides, but typically the headache is on one side. Another characteristic feature of migraines is it's like it's pounding, throbbing. Some people call it pulsating. That's when some people tell you it's like they are pounding yam in my head. That is a migraine. All right, that throbbing nature, boom, 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 inside the head. It's different from when I said in the heart earlier. Remember, right? So in the head, when it feels like something is pounding in your head. That's a migraine. Okay. It's usually worsened by activity. When if you're having a migraine and you try and relax a bit, your migraine might start to go down. All right. When you get up and start doing work, it will start increasing again. That's migraine. You can see how it's different from tension type headaches. Okay, so migraines get worse with activity. When you're having a migraine already, you should know once you start feeling that throbbing, pounding, you know that you need to slow down. Okay, because it's worse with activity. Okay, some people feel what we call an aura. So they see some funny lines, or they feel a certain way, or they just notice that light is disturbing them, and immediately after that, that's when the headache starts. That's also common with migraine. All right, we call it an aura. They just know something funny just happens, especially with their sight. All right, and then the headache starts. In many cases too, they can't stand light. They don't want you to bring light near them. Okay, they can't stand sound. Sound will just make them very, very, very irritable. They can't stand it at that point in time. Some people feel nauseated, like they want to vomit. Some even vomit. These are characteristic of migraines. Okay, so like I said, throbbing on one side, it's worse with activities. You feel like you want to vomit, you can't stand light, all this. That's when you can say, okay, you're having a migraine. Now, I must say that for a lot of headaches, scientists have not really been able to find like a clear-cut cause, but there are certain things that they call precipitants, things that are very likely to cause the headaches. Okay, things that are likely to cause the headaches, and you might want to look out for these things. For migraines, number one on that list, fasting, hunger. Okay, number two, alcohol, particularly red wine, all forms of alcohol, red wine, caffeine. Caffeine is well known for causing migraines. So those of you that take coffee a lot and you complain of migraine a lot, you might be seeing where the cause of the problem is, right? Smoking, of course, bright lights. For some people, weather. So you might notice that when the weather is a particular way, you tend to just have more headache. So the weather can be a factor. Okay. We also have strong odor, strong smells. For some people, that can be the trigger, like perfume. Okay. So if you notice that maybe you bought a new perfume and since then you've just been having a headache or you've not really thought about it, think back. Did you buy perfume recently? Has the headache, have you noticed that? Can you, find an alignment between when you bought that perfume and when the headache started? Think back. Strong smells can be the cause. Allergy, you are reacting to something. Often, allergies can cause migraines. So again, apart from perfume, have you changed something recently? Did you change your water? Did you change your soap? Is there something that, did you change your air freshener? Something that you are reacting to. Okay. um Very, very important. Or did you get a pet, or did someone buy a dog in your area or in your compound? You might be reacting to something and that is what is caused, or you move to a new environment, right? You could be having a reaction and that's what is causing the migraine. So it's important to put all that in mind. Let's see. Oh, another interestingly, too much sleep or too little sleep can cause migraines. Too much or too little. The sweet spot for sleep is 7 hours. Okay, if you want to push it, you can go up to 9 hours, but preferably you probably should not do more and should not do less. So keep it between 7 to 9 hours of sleep. If you've been having a lot of headaches, ask yourself, how well are you sleeping? Are you doing 7 to 9 hours? Okay, and yeah, so those are the commonest cause of migraines. Very important to note. Next, another class we call cluster headaches. You cannot miss it if you're having a cluster headache. It is very unique. Cluster headaches, usually, now, they are similar to migraines in that they usually happen on one side, right? One side of the head. True. But the difference is that there are now other things that will happen on that one side of your head, unlike with migraines. For cluster headaches, if it's on this side, water can start coming out of this eye. Okay. Another thing about cluster headaches is that it can be around the eyes that you'll be feeling the headache. So you'll be feeling like it's around your eye. All right. That's typical of cluster headaches. But to add to that, one very characteristic feature of cluster headaches is that on that same side, the eyes, water can be coming out of the eye. The eyelid can now be drooping down. All right. If someone should look at your pupil, that's the black part of your eye, you'll see that it's very, very tiny. These are characteristic of cluster headaches. Okay, another thing about cluster headaches is that they can last for just 15 minutes and disappear. Yes, can last for just 15 minutes and disappear. Can last for up to 3 hours and disappear. One more thing to note about cluster headaches, that's why I say you can't miss cluster headaches. Anybody, if you are having it, you will know that, oh, this is it. Another thing about cluster headaches is that they can last for 7 days, back to back to back to back to back. Okay. um they can last for up to 7 days, back to back, and then surprisingly they will just stop and you will be fine. Sorry, just a second. Oh, okay, okay. All right. So they can last for 7 days and afterwards you'll be fine. They can last for up to 7 to 8 months. And then for 3 months, nothing at all. So what have I said now? Short recap. 15 minutes per episode now can be 15 minutes or up to 3 hours and just disappear, right? Now, these episodes can happen back to back for between 7 days to up to a year, right? But when they stop, you will not notice anything for months. For 3 months, 4 months, you might not notice anything at all. But when they start, it will be back to back, okay? Back to back to back. Characteristic of cluster headache. So they happen in clusters. Do you get it now? They happen in clusters. So you cannot miss cluster headaches. Okay. So cluster headaches are usually more common among men, especially by the age of 30, but they can happen in women too. A major trigger is smoking. Okay. But again, like I've said before, cluster headaches that's the one that I said can be genetic. Yes, if there's a family history. I mentioned that there's the genetic aspect. So if there's a family history of cluster headaches, you can have it just because of that. All right, there's genetics have now been involved. So you might want to ask your parents, you might want to ask your relatives, does anybody have this kind of headaches that will happen back to back for maybe a few days or months and then just stop for so many months you will not have it and then again to start and it will be back to back again. You might want to ask your relatives. But whatever the case might be, of course, at the end of the day, we're going to now talk about treatment, right? I mean, very important. Even though I can't prescribe drugs, I'll tell you one or two things. The last one I'm going to talk about, we call it new daily persistent headaches. New daily persistent headaches. Okay. Now, one thing that you will use to know, right? I'm giving you things that you can easily use to know which one applies to you. They're usually sudden, from nowhere, and they are memorable. You will always remember what you were doing and exactly where you were when that headache started all of a sudden. They are memorable, sudden and memorable, and they are constant. You see, unlike clusters that will come, give you a break, come give you a break. This one, if the headache is constant, no break, and it can be like that for a month, consistent, especially if you don't take any drug, you don't do anything, it can be like that, and then it will stop. Okay, it can last for up to 4 months, constant, but you will know categorically that this was what I was doing when that headache started, and it's sudden. Okay, so things that can cause this new persistent daily headaches, right? Things like head trauma, right? If it has happened before, I'm not saying that someone hit your head, then the headache now started. No, I'm saying if you have a history where there was a head trauma, you were involved in an accident, something hit your head, later on in life, you could actually develop new daily persistent headaches. Um, what else do we have as a cause? Oh, viral infections, all these COVID-19, Ebola virus, typhoid infections too can cause these kinds of headaches. Okay. Um, yeah. Oh, yes, and something else that can cause this kind of headache, drug overuse. Ah, thank God I didn't miss it. Drug overuse. People who use so many pain medications are at risk of developing new daily persistent headaches. All right, drug overuse. And we're going to talk about that when we talk about the treatment, which is where we are going to right now. So, treating headaches, what's the first thing that you need to do when you have a headache? Number one, score that headache. How bad is it? Over 10. Give it a score. Over 10, score the headache. Now, if the headache is less than 3 over 10, right, immediately start thinking of what could be responsible. We've talked about so many things, right? We talked about the acute ones, talked about primary ones and all that. But what you want to do is, first of all, oh, sorry, before that, characterize the headache. So when did it start? Okay, the headache just started like 2 hours ago. You don't need to be thinking too far. All right, you want to be asking yourself, okay, is it I didn't sleep well? Is it because I've not eaten? Is it because I'm dehydrated? I've not taken enough water? Oh my goodness! Before I forget, the lifestyle issues that cause headaches. Please let me quickly outline them. Number one, chronic stress. Chronic stress is different from when you are stressed right now. Like you had a long day, it was a busy day, you had a long weekend. No, chronic stress, you've been stressed back to back for months. Okay, for months. Even if today you've not done anything, you just woke up and you were lying down on the bed, you can develop a headache because you've had chronic stress. All right. So chronic stress is something that people miss. So people who often tell themselves, "Oh, I'll go on leave in 2 weeks' time, or in 4 weeks' time, or in 3 months' time, then I will rest." When that chronic stress builds up, that leave, you might not be able to enjoy it because you would develop a symptom like headache. There's a risk of that. Another one is I've already mentioned head trauma. Screen time. Screen time. How much time do you spend looking at a laptop, looking at a phone, looking at television, and all that? One thing I try to do, and I've been trying to do it intentionally these days, I don't carry my phone to the toilet intentionally because I started to realize it was a bad habit. And a simple way to cut down screen time is to just not take your phone to the toilet. Seriously, just sit down in the toilet, think about life, you know, think about how you plan your day, whatever it is, think about your goals and aspirations, motivate yourself. But that is a good period to just put your phone aside. Also, I mean, the toilet is not exactly, that's why the phone is, this is how people just infect themselves. Your phone is so full of so much bacteria, and some people will now be eating and be pressing that same phone that they carried into the toilet. And when they start purging, they start wondering why, right? So please find a way to cut down your screen time. Find a way. I think the recommended screen time is about 4 hours per day, if I'm right. I think so. I think it should not be more than 4 hours per day. 4 hours per day in total. Not 4 hours on your television, then 4 hours on your laptop, then 4 hours on your phone. No, it is in total. So it's important that you keep that in mind. However, to be honest, it's quite difficult, especially for the working class people. So even if you can't do 4 hours, I recommend find other ways. Instead of, I was telling someone in the office, why are you sending me a message on WhatsApp? Why are we having a meeting online when we are all in the office? Let's see our faces and reduce the screen time, for crying out loud. Right? So there are times just engage people in person. Walk up the staircase, go and meet at by doing that, you're even exercising. Of which to add, one of the causes of headaches is poor exercise. Yes. If I didn't mention it before, but now that let me just say it, right? Poor exercise is one of the causes of headache. So climb up the staircase, go to that person's office, have a one-on-one face-to-face conversation with them instead of pressing your phone again. Right? Find ways to engage in person. You see people outside, even young people, when you go outside, you have 10 of them, everybody's on the phone. There are 10 of you here. Talk to each other, interact with each other. Everybody's on the phone. Actually, at the end of the day, when you see what they are doing on that phone, I've seen a lot of people in the bus on the phone. It's game they are playing. They are playing game. It's not as if they are closing any contract. They are not. They are playing game. Imagine. Talk to people around you. Engage and reduce that screen time, for crying out loud. Thanks. Another one is oh, and for those who use laptops, you can get glasses. So I put down my glasses because actually I was having a little bit of a headache before I started this. But you see my glasses. I don't know if it's to show in this camera, but my glasses are a bit dark. So what these glasses do is that they reduce the effect of the light from my laptop or from my phone. So they are called photochromic lenses. So you can always speak with your ophthalmologist to get you glasses that can protect you. Just explain to your ophthalmologist that you work with laptops a lot and you need something to protect your eyes. When you have something like this, it will reduce your headaches. For me, mine is a bit different because when I have headaches and I just don't want to see. My glasses are recommended not just for laptop but to increase my sight. Okay, and that's crazy. An explanation of why I put them down when I want to rest my eyes. It's just to rest my eyes and reduce the weight of it. So there's that. But typically, you can get these glasses to reduce the effect of light on your eyes to also ensure that you are not straining. So that you stop straining your eyes, okay, and you stop having headaches. That screen time slash people who need glasses, who are not wearing glasses, slash people who should be protecting their eyes. You see, this category, there are so many people in this category that are dealing with headaches and they've not addressed this issue. So please, please, and please look into this. This is a large percentage of people who have headaches. It's one of these things. I can bet you. Okay. So yeah, and then dehydration. If you are not drinking up to 4 bottles of water per day or 5 sachets of pure water per day, then there's a chance that the reason why you're having headache is that you are dehydrated. That's why one of the first things you will do in treatment is to drink water. Not gotten there yet, but I should probably just say, right? So dehydration. 4 bottles of water, 5 sachets of pure water. Pick one. All right. Um. Yeah. So now we can get back to treatment. So, like I said, first call the headache if you're having a headache. Then try and first of all, if your headache is less than 3, try and think of what could be causing it and stop it. That's like the first step. All right. Identify the cause, think about it, and stop it. Now, this is for acute cases. For chronic cases where you know you've had the same type of headache for more than 3 months, it keeps coming back, coming back, coming back, and it's the same type of headache, you want to speak with a doctor, all right? But for acute cases where you have a headache, it just started, you cannot really say this is a chronic, anything, or maybe it just lasted like a week or so. You might want to now consider doing all this. So think back and try to identify the cause, okay? And stop it. Whatever it is that you've identified as the root cause of this headache, stop that thing. Then after that, you want to assess if after stopping it, the headache remains persistent, or if the headache score is more than 3/10, or if it is stopping you from carrying out your activities, then you use medication. Okay, so this addresses that question of I don't want to get used to drugs, I don't want to get used to drugs. First of all, if the score is less than 3, just try and think of what could be causing it and stop that thing. But now you stopped whatever you think is causing it, but the headache is still there. And now it's getting worse. It's stopping you from doing your activities. Or when the headache even started, it was already more than 3. It was already very severe. Okay. Then please use medication. It's okay. And this is where we now talk about drug overuse. So when you now realize that more often than not, you just have to keep using medication, all right, then you might be dealing with something chronic and you need to speak with your doctor. Okay, so it's okay to use drugs. A lot of people just suffer in silence because they don't want to use drugs. It's okay to use drugs, but when you start noticing that it's too recurrent, then you need to see a doctor and really identify what the issue might be. However, everything I have said now, from your lifestyle to the eyes and all that, please, those are things that you can consider by yourself. Okay, very, very important to know. Do you strain to see? Do you move your face close to the screen to see? Do you strain your eyes? Do you squint to see? Okay, do you spend so much time looking at a screen, whatever it might be, right? Very, very important to look out for those, because once you can identify that, then you can easily find a solution to the problem. Okay, so there's that. Now, what are some simple home remedies you can use? Because for those people who like homemade this, homemade that, there are not many, to be honest, right? That's medically accepted. Of course, when you go and meet the person that is selling gogo niche, they will combine something for you to drink. Me, I don't know. I don't know about the one that they will mix for you. The one that I know that is medically accepted is what I'm about to tell you. Number one is chamomile. Chamomile tea, right? Chamomile helps with headaches, migraines in particular, right? So chamomile helps. Um, Number two, some people have said caffeine can help with tension type headache, but keep in mind, caffeine can also cause migraine. So I would rather just go in the direction of chamomile, right, and just put caffeine on one side so that I don't replace one problem with another. Okay. Another one is ginger. Ginger helps with headaches if you can stand it, because ginger has a very strong smell. Like if you eat ginger, everybody will know. Okay, so but ginger helps. And of course, we have ice packs. Okay, so ice packs, you just put the ice pack on your head and relax. Ice packs really help a lot with migraines. Okay, so there's that too. Again, to add to that, now that's for drinking water too. Like I said, dehydration. So usually it's important to drink water. If you have a headache, just try and drink water to start with. You just might be dehydrated. Okay, and if you've not eaten, so obviously go and eat. Like I said, hunger can cause headache. So all those things that I said earlier, keep that in mind. Exercise. Okay, people who don't exercise often are much more likely to have headaches. It is what it is. All right, that's just it's something. So if you don't exercise, please try to exercise. Like seriously, just exercise. All right, you're likely to just do better generally health wise by exercising. Okay, so but poor exercise is one of the reasons why people have headaches. So it's advisable that you exercise. And there is one. So I forgot to mention, finally, Do you know? And this is something that I know most people don't know. If you know, please, you can put it in the comment section or drop on the group if you've heard of this before. That hot dogs can cause headaches, in particular migraines. Hot dogs, yeah, hot dogs. The one that is inside shawarma, the one that you put inside Indomie. All right. Chocolates can also be a trigger for migraines. Now, they contain what we call nitrites and nitrates, and these affect the blood vessels around your head. And because of that impact, you are likely, it is possible to develop headaches. So that's something that I know most people haven't thought about. So just in case you notice that each time you eat shawarma or you buy shawarma, that's when the headache will start. Or maybe you've not thought about it, it's something to consider. Maybe you buy chocolate and then the headache starts, it's something to consider. So very important to know that. So you probably, if you are dealing with a lot of headaches, migraines and the likes, you probably want to avoid hot dogs, to be honest, right? Because of the nitrates and nitrites. Um, you might also want to check any other processed food. Look out for anything that contains nitrate and nitrites. It could be the thing that is triggering your headaches. So just keep an eye out for any processed food that you consume. Okay, and that is all. I tried my best to run through this because there was a lot of information. Took me 43 minutes. Wow, that was quite long. And now I'll take questions so that we can call it a day. I have dumped a lot of information on you guys about headaches, I know. But the idea was you pick what applies to you because you're not planning to be a doctor. So I am not giving information for you to go and counsel anybody. Pick what applies to you and then run with that. So I will take questions right now. Feel free to drop questions. I'm just going to wait about 60 seconds because honestly, like I said, I was even having a headache before I started this and my mouth is paining me. I'm tired. I want to relax. I've not enjoyed my weekend. That's been from 1 to 1. So yes, I also need to rest. So I'm just going to give 60 seconds for anyone who has questions to ask their questions either on the WhatsApp group or in the comment section below before I finally wrap it up. Feel free to ask your questions. Okay, I can see someone is about to ask a question. Okay, so I think it's just only one question I have. Oh, well, that's good then. So I hope this was quite informative for everybody. I hope you learned one or two things. I hope you have a few action points, things that you're going to check, things that you're going to consider, things that you're going to think about, look into, adjust, make changes around. Yes. Okay. Can low blood sugar cause headaches? Yes, yes. It's one of the things I'll put under acute. That's when you say, oh, have you eaten? If you have not eaten, that could be the reason why you're having a headache. Yes, so low blood sugar can cause headaches. Very, very true. So if you're having a headache and you have not eaten, go and eat. You don't really need paracetamol, just need to eat. And there are many times I've eaten and the headache I was having disappeared. So yeah. What should I do if my blood sugar is between 35 and 55? Your blood sugar is between 35 and 55. Please drink Coke and then go to a hospital because I don't know why the blood sugar will fall that low. That is extremely low. 35 to 55 is very, very low. Drink Coke immediately and then go to a hospital. Let them check you out and find out why it crashed so low. And I better not hear that you are fasting because if you are fasting and your blood sugar comes down to 35, that's the end of that fasting. Like you should never ever fast again because that is too low. 35 is extremely low. I cannot emphasize it enough. It's bad. It's really, really bad. 35, they should admit you and set drip for you and give you intravenous IV fluids that contain glucose. Okay. Then what's the difference between diabetes and blood sugar? The relationship between diabetes and blood sugar, oh, that's pretty simple. Diabetes is a case where the blood sugar is very, very high, right? The blood sugar is very, very high. That is diabetes. Now, what the blood sugar should not be high. Why? Because you can't just have sugar roaming around in your blood to go and start destroying organs. Sugar is meant to be absorbed into your muscles, absorbed by your brain so that you can think, absorbed into your liver, absorbed into your fat and all that, but it should not be roaming around in your blood, right? So when for some reason the sugar is not being absorbed and it's just roaming around in the blood, that is diabetes. Some things that can cause diabetes are taking drinks, soft drinks too often. It does not directly cause it, but it puts you at risk of having blood sugar being too high. Maybe I'll do a session on diabetes to properly explain this. I don't want to go too deep on this, but yes, that's the relationship. Blood sugar being too high is what we call diabetes because sugar should not be roaming around in your blood, it should be absorbed. And I think I've answered that question. Okay, thank you all. I don't think I have any other question. It's been great. Um, okay, let me just be sure that person is. Um, all right, you're welcome. Thank you all very much for joining this live stream. I will see you next week. Please, I hope you were taking notes. I didn't tell you guys to take notes before I started. I should have told you because it was a very exhaustive session, but what can we do? Have a wonderful week and be good. Okay? Yeah.